Knock, knock, knock. Hand hygiene. Hello, I'm Kaylee. I'm going to be talking to you about what your doctor is sending home with you for your 10-year-old son, Donald. There's 3 medications that you're going to be given. It is the ketotifen. It is for the allergic reaction for his eyes. So what you're going to do is you're going to do 1 drop in both eyes for 7 days, so a whole week. Again, this is for the eyes. You're going to do it twice a day. You're going to do it 8 in the morning and 8 at night. The way that you're going to administer these, have you done this before? Patient's parents say no. Okay. So what you're going to do is you're going to make sure that you wash your hands. You're going to make sure that Donald is laying down or at least sitting down with his head slightly tilted back. You also want to make sure that you don't use this on anybody else. You want to use it just as prescribed. What you want to do is you want to get a warm washcloth because you want to clean the site first before you administer the eye drops for Donald. So you're going to take a warm washcloth and go from the inside, wipe from the inside out, take a different part of the washcloth and do it again on the other one. After that, what you're going to do is, you're going to take off the cap to the eye drops. You're going to pull the lid, and then you are going to have the eyedropper 1 to 2 centimeters away from the eye, directly in the middle. And you want to place it right there in the center of the eyes, on both eyes. After you do that, you want him to close his eyes, wipe any excess off. It might be helpful if he wiggles around a little bit or fights you a little bit with doing the drops, if you have like a paper towel or washcloth to catch any of the dripping of the drops that don't get in there. But like I said again, you are prescribed only 1 drop in both eyes for 7 days. Your doctor is also sending you home with drops for your ears for Donald. It is ofalaxin Otic solution, 0.3% for a mid-ear infection. What you're going to do is the same exact time that you do the eyes, for 10 days, you want to administer in both ears 2 drops. Okay, so this is going in the ears. It's twice a day. It's 8 o'clock in the morning and 8 o'clock at night. After that, basically what you want to do, you want to make sure that Donald is sitting in the same position that he was for the eye drops. You can go ahead and he can sit there and wait, and you go grab the ear drops or just have them both right there ready. After you do the eye drops, though, you do want to wash your hands, and then you want to do the ear drops. So what you want to do is you want to create friction around the ear drops bottle and warm it up some, or you can run it under some warm water. Since he is 10 years old, you want to pull the ear up and out. Okay, if he was 3 years old or younger, you would want to pull it down and out. All right, so you'll pull it up and out. You're going to clean the site. You can use a Q-tip, you can use a warm paper towel and then dry it. You can use a cotton ball, whatever you need to use, whatever you have readily available is fine. Just make sure that it's clean. So what you're going to do is Donald is going to lay on his back. He's not going to look slightly up. He's going to go to the side of whatever side that you're about to administer the ear drops in, and you're going to put it on the side of the ear canal and basically just let it run itself in there. You're going to do 2 drops twice a day, 8 in the morning, 8 at night. After you put the drops in, you want to massage the trachea, trachea. You want to massage that area so that you make sure that you get it in there and that it goes down into the ear and helps with his ear infection. If you don't, it might just sit there and then it could run out. So you want to make sure that you massage it in there. You want to also have Donald remain in this position from 2 to 5 minutes before you do the other side so that it gets absorbed and everything in there. The last medication that your doctor is sending you home with is epinephrine for anaphylactic shock. So, Donald is seriously allergic to bee stings. So if at home, say he gets stung by a bee, okay, you grab the epinephrine pen, which you probably know as an EpiPen, and what you want to do, this is just as needed. You don't do this every day. You don't do this, just because. You do it when he starts showing any signs of, in his face, in his airway, in his skin, maybe around his abdomen, and then also in his body, if he's, wobbling around, or if he has no energy or anything like that, or if he faints, and he got stung by a bee. You want to go grab your EpiPen. What you want to do with this, make sure that your hands are clean. And pull off the cap. Have 2 fingers spacing from the top, okay? You're going to grab it like this. On the outer side of the thigh, the upper thigh, you want to push it in there. You want a steady motion, so you want like you're about to throw darts. So you want to, on the side of your thigh, do this with your EpiPen. Hold it down for 10 seconds, okay? It is really important that you count out loud 10 seconds so that the medication can get in there. After that, you do need to seek medical attention. It is only to get you to the hospital and for you to make it to be able to get further medical attention and further things done for Donald to stop his anaphylactic reaction.